I'm looking to create a narrative for our story. Life is a journey, and I do believe in order to empower ourselves, we must tackle the issues that hold us back. That's why I created Inquisitive I Am, a show designed to help you live a healthier, wealthier life. Welcome to another episode of Inquisitive I Am. Today we have zooming in from Mobile, Alabama, the incomparable Dr. Nina Ford Johnson. She's going to come and talk to us about coronavirus or COVID-19 or corona, whichever one you prefer to call it. But she's going to zoom in tonight so we can have a serious discussion about how this pandemic is affecting the community and what we can do to better our health and to avoid it as much as we possibly can. I can't wait for you all to chime in and zoom in with us and comment in the section below as we go live right here tonight on Inquisitive I Am. Don't go anywhere. Welcome to the show. My doctor, my friend, Dr. Nina Ford Johnson in the house, MD. How you doing tonight, girl?
I'm good, sis. Thank you so much for inviting me here tonight. So glad to be here.
I'm so glad you're here. How are those babies?
Wonderful, wonderful, good and terrible, but growing, getting big, loving life. So they're doing great. Thank you.
Wow, wonderful. And the hubby, gotta give him a shout out too, because
yes, he's hanging on in there. No, he's doing fine. Thank you.
I'm sure he is. I want to get right into the topic because it has been scary. Not much has changed as far as what we're dealing with. The crowds are getting bigger. It's like if you didn't know that there was something going on, then you would never know. So I called you to the rescue, as I always do, whether it's personal or private. And we need to get to hear from a Black practicing physician. We need to hear it from you, what we need to do, how we can focus and better our health, and how we can avoid the whole pandemic of what's going on. What can we do to better ourselves? So I have to ask you first, what is COVID-19? Because that's what this is mostly about. What is COVID-19 in your words?
So COVID-19 is a virus, and it's a subset of the coronavirus that has been around for ages. It's just a different variant of coronavirus, which is the regular coronavirus causes the common cold. So when COVID-19, 19 stands for 2019 because that was when it was discovered. And so we've seen COVID cause symptoms or cause no symptoms at all. And it can cause symptoms like the common cold, cough, runny nose, fever, body aches, things like that. But then you have COVID disease, right? And that's the serious disease that puts people in the hospital that can cause pneumonia. It can affect your heart. It can affect your GI system, cause diarrhea and dehydration and vomiting. It can even cause issues with your kidneys. And then, of course, one thing that's really scary, it can cause issues with your clotting system. So that's why you'll hear people where they were doing fine and then all of a sudden they died, either through a pulmonary embolism where a blood clot got in their lungs or in their brain that caused them to have a stroke. So that's sort of like the COVID disease. So it's a long spectrum that you see that COVID can run and cause.
Oh, girl, listen, I think just hearing you say that, because you've taught me something just in those words, you taught me some things. I didn't know that there was a difference between COVID-19 and an actual disease which causes people to pass away. So that was something that I'm sure you've not only informed me of, but informed the listeners as well. So with knowing that even the healthy people that are passing away, and we know that they're saying, or it has been said, or reports are saying that it has affected the Black community more so than any other culture. What ways, what is it that we need to do first to try to avoid it as much as possible? And I say that because as humans, we are anomalies by default. So I tend to stay away out of the crowds because accidents, that's why they're called accidents. You just never know when it's going to happen. So what things do you give us as far as even being in crowds or health benefits wise to keep us in the best shape? Or does that even really matter at this point?
You know what? It definitely matters. So you still have to make sure you take care of yourself, and you have to exercise and eat right. That never gets old and it never gets tired, even in the midst of a pandemic. I even tell people who have become newly infected with COVID disease, you still need to move around. That does not give you license to lie in the bed or lie on your couch. You have to go outside, either even to your backyard or to your porch or to your front door, and get some of that vitamin D because that's necessary. So you still have to move around and be active, and you can still do that and be socially distant from others. I do recommend that you don't forget your yearly exam with your primary care physician. That is still necessary and it still needs to happen because you can die from other things besides COVID. You can still have a heart attack in your 30s and your 40s. You can still have a stroke. You can still have diabetes and undiagnosed hypertension. And that's what some of the doctors I've been encountering saying, that they say what's going on. The ones who are sick and in the ICUs, they may have undiagnosed diabetes or high blood pressure or obstructive sleep apnea that has gone unchecked for years, because they think that they're healthy and we think that, we'll live forever. Well, this virus has exposed some things, especially in our community, because sometimes we don't have the access to healthcare that we should have. And so there's a whole bunch of comorbidities and discussions that we need to discuss as a community. So why are we dying more? Why is this disease affecting us more than others? Why are we 2 to 3 times more likely to die from COVID when we hit the ICU than someone else? So those are some things that we need to discuss, but never neglect yourself, especially during this time.
Thank you for saying that, because there's been a lot of talk where we talked amongst each other. And I think a lot of the young children, with me dealing with a 23-year-old and an 18-year-old, they seem to sometimes think that they won't catch it for whatever reasons that they convince themselves. And I think a lot of us as adults, clearly with the crowds and things that are continuing, that I've seen in Mobile and that I've seen in Huntsville, that the crowds are still continuing. So people are mentally believing that they won't get sick or they won't die. That's the worst case scenario, and that won't happen to them. So I guess one of my biggest concerns is we're waiting for someone to govern us. I can't talk tonight. And I'm beginning to wonder, why are we waiting for that? Shouldn't we be governing ourselves accordingly, with knowing now that we're seeing people close to us pass away? I think in the very beginning, I said to myself, I don't know if this is real, or I didn't want to believe this was real. The people that were passing away initially, I didn't know them at all. It didn't seem to affect my community at all in the very beginning until I saw someone sick of it. What can you tell us as far as how do we govern ourselves when we are near someone that has it and we have to maybe care for them? What advice do you give us for that?
And that can be very challenging. I do recommend, like, you as a caregiver to double mask, and even to wear gloves and, do the standard precautions in terms of bleach and Lysol, making sure your house is clean and that you're cleaning, get the groceries delivered, make sure you have them, take their vitamins, and you as well. That goes for the caregiver too, because the caregiver can get sick during that time too. I was talking to a church member of mine who actually received the vaccine, and she received the 2 doses. And at first she was hesitant on getting it. And she works in the hospital very up close to COVID patients. And she's seen so much, but she was so hesitant on getting it. And we talked about it and she said, okay, I'm going to get it. And let's see, like less than a month later, her husband caught COVID and he got real sick. And so she had the opportunity to take care of him. So she had to take off of work and spent time taking care of him and nursing him back to health when he was on oxygen dependent in the house. But she never caught COVID, not one time. And that think that things is introduced to our community because this is science, and then Black people were instrumental in procuring this vaccine. So it is one that can be trusted. And she can say that because she had the vaccine, she did not catch COVID, even though she was taking care of her sick husband for about 2 weeks.
I'm glad you brought that up because, of course, that is now a lot of the talk as far as us being scared to take the vaccine. Rightfully so. I totally understand that. I'm a little hesitant, as so many of us are, but hearing you speak on the actual vaccine, that may make a lot of us feel better about the vaccine. Do you feel that should we have a checkup and make sure we are in good health before we decide to take the vaccine, if that's something we choose to do? Or do you think it's okay to just go ahead and take it just for extra precautions?
No, I think as soon as it is offered to you, I will go and take it. Just because the lasting effects of COVID, if a person were to get infected with COVID, you may feel better after a couple of weeks or a month. But I had a child who came in just this past week, and she's been, I guess her last COVID positive test was over 2 months ago, and she's still feeling the effects of it. And it's really weird. And some of those things, we don't know the answer to, or why are people so fatigued after having COVID? And so I feel that one, you should get it as soon as it's offered to you, no matter what the vaccine manufacturer is, whether it be Pfizer, Moderna, or there's a new one coming up, AstraZeneca, which is it's a one shot, so you only need it once. Instead of Pfizer, Moderna, you need to take 2 doses of that. But as soon as it's offered to you, you should get it. And then definitely go talk to your primary care physician and get that annual checkup done, because you don't want to miss a hypertensive diagnosis or a diabetic diagnosis for you personally or any other family member. Because then again, it may not affect you. COVID may do, you may not have any symptoms from COVID, but you don't know what it may do to a sibling or a parent or an elderly neighbor. And that's what's the scary part.
Yes, that is very scary. We talked the last time you joined me on the show, which was probably a year ago now.
Yes.
And we talked about diabetes and other underlying issues that could affect us more if we become sick with anything else. Let's talk briefly about and summing up some of the things you discussed then so people can know, because I think a primary care physician is very important. I have one, my children, we all have the same, and I'm still recommending my primary physician. Shout out to Dr. Barbara Mitchell. I love her to pieces, but you're absolutely correct on that. So let's sum up some of the things we talked about as far as diabetes and what we need to do to make sure we get these annual checkups to stay as healthy as we possibly can.
Right. And so it's so important that, you get those annual checkups, because you want to find out what your hemoglobin A1C is. And that measures the amount of glucose that has been in your body for 3 months. So you can't fast the day before your checkup and expect your hemoglobin A1C to be normal or below the required numbers that it should be. And so that's one thing they may check. They may check your cholesterol levels to determine how much fried and fatty foods you've been intaking. Or maybe there's a family history you didn't know anything about that may set you up for having high cholesterol. Then also your blood pressure, because especially around 30s to 40s, that's when blood pressure and hypertension actually arises. And I'm actually seeing it in younger populations and my youth. And we don't know why. Some of those children do not have a family history, and these kids are not necessarily what you call big or obese. These are regular looking kids with high blood pressure. So it goes for the adult as well as the child. Every child needs a checkup, regardless if they're going to get shots that year or not, because you want to make sure that everything is going exactly the way it should. So those are just a few things: blood pressure, diabetes, your cholesterol, even vitamin D. Vitamin D is so important because it also helps with your mental health. It helps, especially some people with low vitamin D may actually have signs and symptoms of depression. And so if you fix the vitamin D, then there goes the mental health, and that may improve that as well. Because we're not a type of people sometimes that goes out and exercises in the sun, which is a great source of vitamin D, like we should.
Ooh, you hit another amazing point. I too, over a year ago, was diagnosed with vitamin D deficiency. I was
Yes.
fatigued. I was just tired. Probably was a little depressed and thought it was the norm, but my vitamin D was extremely low to the point
Yes.
to where my doctor was like, "Hold on, you need to sit still. You need to find ways to let's get you this prescription to hurry up and get your vitamin D." It was extremely low. I think she was appalled at how low my vitamin D was. And I think because we do have melanin, we don't know that as we
Right.
get older, that's something we need to pay more attention to. So I try to pay more attention to my vitamin D, my iron, and all of those things now because I have had a history of that. But I did not know that vitamin D plays such a vital role in your mental health, in just living and doing and having the things you need to be healthy. So I'm glad you brought that
Correct.
up. And then you brought up diabetes, where a lot of us think that diabetes tend to affect those who are obese. And you hit on
Correct.
that it does not.
That is correct. That is correct. No,
Mm,
diabetes can affect the thin appearing, it can be, we can see it in families, so genetics may play a role in it, but you just never know. So that's why it's so important to get that evaluated and checked, because after a while your metabolism doesn't is not as high or as good as it was when we were younger. And so that can change a lot of things with our bodies the older that we get. And I definitely want to remind our ladies, especially our Black women, that we need to make sure we go for our annual pap smears and those mammograms and things like that. We definitely need to check up on that. And then you hear about the deaths of the young, like Chadwick Boseman, who died of colon cancer. They were recommending colorectal screenings, colonoscopies at 40, 45. But if there's a certain family history, if you have symptoms, you may need to start getting that early at 35. So there's certain things that we need to kind of look out for and talk it over with your primary care physician when you can.
yes, absolutely. Ladies, my men, I hope y'all are taking notes. And I hope after you've watched this, you make the decision tomorrow morning.
Yes.
On Thursday morning, you make the call to find or check around to have you a gynecologist, whom I also hold dear to my heart, and your primary physician. So I'm hoping you all are really taking all of this in. You're getting to hear it firsthand from someone that's in your community, that is of your community, and that is of us. So it should definitely give you a better listening ear so you can understand what's going on around you and you can make better decisions for not only yourself, but your loved ones. In closing, Doc, because I know you got to get back to those babies, what advice do you give us all to be better, to do better? What advice do you give us all?
Now, I'm a big proponent of self-care, and that's something that we cannot neglect because we take care of so many people, and that's just who we are. But we also must remember to take care of ourselves. And that means to eat right, watch the processed food, drink plenty of water. If you can drink a gallon a day, that would be awesome. Um, Make sure you exercise at least 3 days out of the week, for possible, for over 30 minutes at a time to get that heart rate up. If you need to go get a massage, if you need to read a book, take a walk in the park, especially to my moms out there. I have such a heart, especially the single mothers. You have to do something for yourself. If you need help, reach out. Please do. You can't be the super one to everyone, but you must recognize that you have to do some things for yourself and that it's okay.
love you so much.
I love
Oh
you
gosh.
too.
I mean, this is really powerful. You gave me chills
Oh, you're
when we
so
talk about
sweet.
self-care, because that is
Yes.
something that I definitely am trying to do better. I spoke on a while back of how I'm dealing with the what is it called? The empty nester syndrome. So
Mm.
I'm having to learn to reel it back in and say, okay, Nicole, you taking care of them. It's your turn to take care of yourself. So I'm glad you said that. It was a click for me and a reminder to me, okay, I need to find something to make sure I'm taking care of myself, because I've been horrible at that. I've always been horrible at that. So thank you for that reminder.
Yes, you must do it.
Yes. I'm going to do it. Duly noted, checked off. Doc has written my prescription. So I'm going to make sure that happens.
Very
I thank
good.
you, Doc, so much for
Yeah,
coming in, giving me some of your time. Tell the babies in the hubby, thank you for giving me some of your time. I'm
of
sure
course.
that this Zoom meeting and this live will resonate through thousands of homes, because it should. We need to know what's going on in our community. So I want to thank you again for coming to see me again. I love you. Good night.
Love you too. And thank you for all that you do.
Thank you.